Hi, are you suffering from severe back pain, or are you concerned about a friend or relative? If you are, then this talk today is for you. I'm going to tell you some ways that you can help to ease the pain right now. Also, answer some questions about should you move or keep still, and what exercises should you do. And finally, when should you seek professional advice? My name's Steve Massey. I'm the director of Back Doctor Chiropractic Clinic in Chester, UK. You can check out my website on www.back-doctor.co.uk. Now, if you have any concerns, if the pain is very severe, and especially if the pain started straight after you've had an accident, a road traffic accident or a fall, in your back or your neck, then you should always seek professional advice. In addition to this, I'm going to list some conditions and signs which, if you have any of these, you should always seek professional care. If you suffer from weakness, loss of sensation or unusual sensations in the arms or legs, loss of bowel or bladder control, heat or swelling in the area of the pain, an open wound, blood in the urine, chest pain, or if you have any serious underlying medical condition, you should always seek professional care if you have a severe episode of back or neck pain. However, I hope I haven't worried you, because in reality 98% of people with back pain do not have any pathology, do not have anything wrong with them that needs to be worried about, and we can go straight on and look at treating you by conventional mechanical means. And the first thing you want to know is, how can you ease your pain right now? I always recommend the use of ice. You can use frozen peas, or if you have one, an ice pack. You wrap it in a tea towel and put it on where it hurts for 20 minutes. Then you can take it off for 40 minutes, let the area warm up, and you can keep putting it on as much as you want. Don't underestimate the power of using ice. What ice does is that it slows down the nerve traffic, so you just feel less pain. The whole area becomes numbed, and it also helps to reduce inflammation. If you don't like ice, or if ice doesn't work for you, try heat. Or you can try alternating ice and heat. That can be very effective. There are a number of painkillers you can buy over the counter. Aspirin, ibuprofen, cocodamol. If they're not working, then go to your GP, get something a little stronger. There's a number of proprietary gels you can apply to the area of pain. Some people like ibuprofen gel, cocodamol gel. I particularly recommend something called Biofreeze, which we sell in our clinic. There's also deep heat. Now, when people are in severe pain, they very often hold their breath, or they breathe fast. And this will actually make the pain worse. So you need to take control of your breath. You need to sit comfortably and take deep, slow breaths. It will really help you to feel better. It will take your mind away from the pain, put it on to the breathing. Because taking the mind away from the pain is a very powerful tool in the short term. You can go for a walk, look at your environment, watch a DVD, a comedy DVD, go and visit some friends, have a chat with them. Anything that will take your mind off the pain for a period may help. If you do any relaxation, if you know any relaxation techniques, you can do positive visualizations, that sort of thing. Now, a question that people often ask is, should they move or should they keep still? In the past, it was recommended that people should spend 3 days or so just lying in bed until the pain has subsided a bit. Now, that is no longer recommended. It's not a good thing to do. You should try to keep moving as much as possible. For your low back, just walking. For your neck, little movements. You don't want to keep your neck still. Don't do vigorous movements. I'm not recommending that you should do a major exercise routine, but just keep yourself moving. Of course, sometimes the pain might be so bad that you may need to just rest and relax. And of course, that's okay to lie down on a firm surface or sit somewhere and just rest. But don't do it for more than half an hour or so. Get up and try to keep moving. When you sit down, sit with your back against the back of the chair and with it supported. You can put a little cushion behind your back to hold you up. For your neck, the best sort of pillow are those ones that have a little bump at the bottom where you can rest your neck. And you can imitate one of these pillows by taking a towel, rolling it up and putting it inside your pillowcase. And then lying down with the pillow supporting your, with the towel supporting your neck, the pillow under your head. Now, some exercises can be helpful when you have back pain. However, you really do need to seek professional advice before you try any exercises, because you need to have a diagnosis. Some conditions, one exercise will help, another exercise might hinder it. And then another condition, the exercise that helped the first might hinder the second. There's one exercise that is fairly harmless and seems to help people ease a little bit of pain. That is to lie on your back and raise your knees to your chest. That gives a nice stretch to your lower back, and then you can rock back and forth gently. If you want to see some of the exercises that I give to my patients, you can go to my website and download the exercise sheet. If you're going to try anything, please be very gentle and very careful. Don't overdo it when things are at their worst. If you visit Back Doctor Chiropractic Clinic in Chester, you will get the best professional care. We will give you a full medical examination, followed by a comprehensive treatment program which will include gentle home exercises. So that not only will we get you over the pain, but you may feel better and move better than you have done for a long time.